Yeah, there it goes.
Hi everyone, how are you? I miss all of you so much, but I thought I'm going to bring some massages to you so you can do some self-care. And I thought we'd talk about the lower leg muscles today. And what we're going to talk about is the gastrocnemius and the soleus, which are both on the lower leg here. And they both insert into the Achilles tendon. I'm going to show you a picture of the gastroc and the soleus. We call it the gastroc short, but it has two bellies to it, and then it has an Achilles tendon which goes up almost halfway up. It goes pretty far up the leg, the Achilles tendon, although we usually think of it as only going to this area. And underneath it is the soleus muscle, which is deeper than the gastroc, and it joins the Achilles tendon again to go down into the ankle. The difference between these two muscles is the gastroc crosses two joints. It crosses the knee and it crosses the ankle. So because of that, the soleus only crosses the ankle, but because there's a difference, we have to massage it different. We have to do a difference on it. So what I'm going to do the gastroc, I'm going to keep my legs straight. I'm going to take some of my sports balm, and I'm going to massage into the gastroc muscle, knowing that the gastroc has two bellies to it. I'm going to take the flat of my hands and massage it and get to know it. Get to know where the tight spots are, if there's any kind of soreness to it. Sometimes when a muscle is tight, it's sore. And after I do this for a while, I'm going to take my fingertips and split it. So as I split coming up, it will form the two bellies on my hand. And this is the gastrocnemius. Inserts into the Achilles tendon, as I was saying. And now another technique so we can go deeper into it is something called pin and stretch. The action of the gastroc muscle is it causes the foot to point to cause it to do something called plantar flexion. So in this, we're going to do the opposite motion. I'm going to put my hands on the gastroc, and I'm going to pull up on my foot, pinning and stretching it. Here again, I'm going to come a little bit further down, and then come up and relax my foot. And further down, come up, and then relax. Come up, and you'll see that you can go in deeper to the muscle. And then I'm going to take the whole muscle and just massage it. And next, after this, after we got the gastroc, we're going to go to the soleus. And ideally, the knee should go about 90 degrees. It doesn't have to be exactly 90, but we have to change the position of the leg. So again, so we know that the soleus is underneath the gastroc, so it will go a little bit deeper. And we can find those nice two bellies of the gastroc. And then the soleus comes a little bit further down, about here. It gets to be more superficial. And then we can find it on the sides also. And it goes into the tendon. And we're going to do the same pinning and stretching to get in deeper. So we're going to take the muscle here, and then we're going to dorsiflex the foot and for a little bit and relax it. Pin and stretch. Sometimes you'll find some sore spots here. Pin and stretch. And here, ooh, on me, that was a little bit of a tightness right there. I'm sure you're going to find some tight areas by doing this. And then we can take the whole gastroc and the soleus and we just massage it together. And by now it should feel pretty good, a lot softer. Next, we're going to go to the Achilles tendon. The two muscles form the Achilles tendon. I'm going to take the serum, the tendon serum, and go onto the Achilles tendon. The Achilles tendon feels like a cord. And some people that have had tendonitis, the cord will be very tender, and they'll have adhesions, which is thickening of it. Not all tendons have the thickening on the outside. But if you do, you take your finger and you do little circles, and this will produce some circulation into the area. And the serum feels really good on it. It allows it to slide your fingers, and there's clove in there, and there's a lot of different essential oils that really help get the inflammation out of there. And now we're going to do the dorsiflexion again on the Achilles tendon. We're going to put our finger here, and then dorsiflex. Again, dorsiflex. Again, dorsiflex. So now we got the whole tendon. We have the gastroc, we have the soleus muscle, and it all feels really good. Well, I'll see you next time. I hope you enjoyed this video, and I'd like you to send me some messages on what you would like me to concentrate on, or problems that you're having, anything. I just would like a connection so I know further what to do. Thank you so much. Bye-bye.